Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder here. We're looking in from the back to the front. There's something in our face over here. We're going to look at that in a minute. But this is your biceps tendon right here. As we look at the biceps anchor, that actually doesn't look that bad. A little bit of fraying, but not too bad. I think what read as a slap lesion is all this torn tissue. We're going to look at that in a minute. But this biceps anchor at this point, there's maybe a little bit of evidence of a split there. See how that peels back a little bit? And of course your symptoms have been in line with having some problems up in this part of the shoulder. But I'll be honest, it's not as bad as I thought it was going to look. Now your rotator cuff here at the top of the screen looks great. This is your rotator cuff. That looks great, so that's not the problem. Now let's have a look at this torn tissue here. Yeah, so we can see what's happened here. The labrum tore all the way along here. And this is displaced. Okay? And so you can see how when this is just not being filled up with water, how this could sit here and look like a torn biceps anchor. Your shoulder was not unstable. We did examine your shoulder before we started. This is the posterior shoulder capsule and posterior aspect of the joint. And so for starters, we're going to trim this, and then we're going to see if we maybe have to do a labral repair a little bit more posterior. Okay, so here's our shaver. This allows us to very quickly remove this torn labrum here. And we can see where that's peeled off the bone there. And it's really, and putting this all together, may have even been a type 3 slap lesion that we just debrided. But the rest of this sure looks pretty good. Again, I'm hesitant to take that down as good as it looks. I'm going to look down the front of the shoulder next. Okay. So we're going to go off on the video, have a look from the front to the back. Switching sticks, 2 of them. Okay, so now we're looking from the front to the back. So this is that posterior labrum. This is where the tear was. And I'll tell you, I can hook it. I can lift up on it a little bit, enough to maybe put an anchor down there. Let me see a spinal needle, please. Okay, so we're using this spinal needle for a couple reasons. One is as a probe, and the other is to kind of plan if we're going to put an anchor down, which is pretty easy to do, and they're really small, so I can't think of a reason not to use an anchor to stabilize things here. The anchor would go down about like that. I'm just trying to see where the labrum is the most unstable. Actually, we may end up doing 2. Okay. Yeah, that. Okay, good. Okay, so here we're drilling the hole for the first anchor. And so these are 1.3 millimeter all suture anchors. We'll go ahead and mallet these down into position here after drilling the hole. Okay, and once they're down in position, we'll go ahead and back out. And there you can see how it gives us 2 nice sutures to work with, 2 suture tails that is. We'll seat the anchor like that. Okay, and now we're going to go ahead and take a what we call a turn to the right suture hook. We'll show you what that looks like here. Okay, so it just looks like this. And our whole goal here is just to come underneath the labrum. We'll lift up on the arm here. We want to finish right about here, which means going into the labrum. Lift up on the arm. And we'll sneak up right about where you see that soft tissue moving. That'll be a good bite. Okay, there you can see how we do that. Okay, so we're just tying the first knot. You'll see that slide down into position right here. Okay. And now we'll just go ahead and tie some half hitches behind that to secure it. Then it looks like we're going to have to pass one more of these really small anchors just to make sure this labrum doesn't tear anymore. Okay, pause. Okay, and so now we're looking at what's remaining here. Remember that big tear that you had, that displaced tear all started right in this region. And we've already prepared it. So I think we're going to place one more anchor in right about here just to make sure that this labrum stays secure. Okay, so there's our second Y knot anchor. Again, this is a 1.3 millimeter anchor. It allows us to secure the labrum with a very small footprint. We'll take a crochet hook, please. Okay, and now we're ready to go ahead and pass another stitch right around here. Okay, so there's our second suture, and at least now this labrum is stable. You can see I tug on it with the tip of the cannula and it's not going anywhere. And that certainly looks a lot better than having that big displaced tear that you had at the beginning of the surgery. Now the question is, do we have to do anything down the front? Crochet hook. And again, you didn't dislocate and your shoulder wasn't unstable. I'm going to take a shaver here and have a look. Okay, so we did put in one anchor in the front just to secure that labrum and hopefully give it a chance to heal so it won't tear any further, any more here. The biceps tendon anchor, even as we look posterior, that looks okay. I'm not going to take that down. So we're not doing a tenodesis here. I'm going to slide around the other side, and we'll look back around this way. And we can see here, I think that now looks secure. We'll come back around the biceps. Yeah, so I think we're done inside the joint. We're going to do a decompression, have a look at the superior part of the cuff, and show you that in a minute. Okay, so now we're looking in the subacromial space, and things are checking out pretty good. The rotator cuff is fine. We're putting in our shaver just to show you here. The rotator cuff's going to be down below. And so, hold this for me. So as we rotate the shoulder, we can watch the rotator cuff move, and all the way to the front up here, all the way through. That rotator cuff looks great. No signs of any problems there. So now we're going to go ahead and do a little bit of a decompression with a shape with a burr. She's got it. And we'll show you when we're done. Here's what's left of this bone spur in the front. We're going to start under here and just sweep underneath. Okay, so that looks a lot better now, a lot more open. Like we talked about, it's pretty big curvature on the anterior chromium there. And now we've resected it both anteriorly and laterally here. Okay, so I think we're done. We're going to be finishing up here and getting you back to the recovery room in just a few minutes. So good luck to you now. Bye-bye.